Let's read about scabies. So 15 questions about scabies. What is the causative organism of scabies? Abdina, Sarcoptes scabies, war hominis. What is the mode of transmission? Fomites and skin to skin contact. Fomites are the things that we share with each other. Now fomites like bed blankets, pillow, whatever is shared, that is fomite, and skin to skin contact. Most common site of involvement is circle of Hebra. Circle of Hebra, Abdina, it involves the axilla, wrist, elbow, nipple, groin, umbilicus. Idella na circle of Hebra. I'll show you a picture of the circle of Hebra. So this kind of forms a circle, as you saw already. So now it is called as a circle of Hebra. That is the most common site of involvement of scabies. What is the investigation of choice? Potassium hydroxide mount. And drug of choice, we have topical and systemic. Topical abdin patana, it is 5% permethrin, and oral abdin patana, we have ivermectin, which is 200 micrograms per kg. Now typical presentation is pruritus, which is intense itching. Intense nocturnal pruritus is a typical presentation, and pathognomonic is Barrows. So Barrows abdina stratum corneum. At the level of stratum corneum, you can see the Barrows, especially between the fingers, finger web spaces, we can see. So what is causing the Barrow? The female parasites are causing the Barrows. And at the level of stratum corneum, the most severe form of scabies we have Novian scabies or crusted scabies. So adha soften pandradhukku you give salicylic acid. Okay, to soften it you give salicylic acid. And then what is the risk factor for Novian or crusted scabies? The risk factor is immunocompromised individuals. And what is the treatment? Prophylaxis. Prophylaxis of scabies, what do you give? 5% permethrin and oral ivermectin. What is the incubation period of scabies? It is 3 to 4 weeks. And drug of choice, we know already. So facial scabies is seen in adult or infant. Facial scabies is seen in infant scabies. And scabies, which is seen as an hypersensitivity reaction to the scabies mite, it is nodula scabies. So it is a type 4 hypersensitivity reaction. And what do you give? How do you treat this? Antiscabitic agents along with intralesional steroids. And for pruritus, you give crotamidone. And what are the fecal pellets in scabies called as Skybala or Skibala, I don't know. And circle of Hebra, you know. So that is axilla, wrist, elbow, nipple, groin, and you have the umbilicus. So that is forming the circle of Hebra. So that's about scabies, people. Bye. So along with the finger web space, that's forming the circle of Hebra. And how do you apply the permethrin abdin patana, which is neck to toe in adult and head to toe in the case of children. Okay, and you ask the patient to wash the clothes in hot water. Okay, that's it.